Time for what is now Medical Minutes presented by Lake Cumberland Regional Hospital. And it's so good to have on the phone with us this morning calling in RN Mandy Lynch. Mandy is the Director of Behavioral Health at Lake Cumberland Regional Hospital. Good morning, Mandy.
Good morning.
It's good to have you on the show this morning.
Well, thank you. I'm glad to be here on Say Something Nice Day.
It is, yes. So let's talk about behavioral health, Mandy. That's what you focus on at the hospital. When we talk about behavioral health, what exactly are we talking about?
We're talking about any of the diagnoses that would qualify you mental health. So anything in depression, anxiety, bipolar disorder. When you get into our geriatric population, we're talking about the neurocognitive disorders, the dementia, the Parkinson's, memory disorders. And some of those bleed into behavioral disorders just simply due to the way the disease progresses.
And with behavioral health, Mandy, what exactly do you do at the hospital, and how do you work with patients, and how do you help them through their behavioral health issues?
So what we would do, a patient who would be on our unit, we would first meet with a nurse on admission, and then the interdisciplinary team, which is composed of our counselor, our discharge planner, and our doctor, as well as the nurse, would meet to discuss the needs of the patient. So the patient comes in with severe depression and suicidal thoughts. We're going to meet to come up with a plan to keep them safe, and then start to address the issues to help get them stabilized so that we can get them back to their normal routine of life. That course of care may include group therapy. It may include bringing in the medical doctor or the hospitalist team to address any of the physical issues that may be going on with the patient. We may be looking into some help with coping mechanisms, of course, medication management, and addressing medications that could help with any of the issues that they're having. And then they're going to get, if they need an evaluation by occupational therapy or physical therapy, as well as any of the lab imaging studies that may be needed for the patient. And group therapy is a huge portion of what we do.
Yes.
Meeting with the counselors, talking about what's going on, what we need to work on to get our mental health healthy.
And can people who feel like they're going through some behavioral health issues or have questions, can they come see you? Do they have to make an appointment? Do they have to be referred? How does the process of coming to see you work? Is a lot of it outpatient work?
We don't do, for our inpatient, for what I'm speaking on today, we are only an inpatient setting. So patients that feel like they need a little higher level of care, let's say they've met with their counselor, they've been on medication, it just doesn't seem to be working, they're still having thoughts of wanting to hurt themselves, or they don't feel in control of what's going on, they could reach out to their primary care provider or to their counselor and say, I feel like I need to be hospitalized for treatment of this, much like you would if you had an infection and you had tried antibiotics and it didn't work. You needed a higher level of care. So you could think of mental health treatment in the same fashion as we do physical issues. And if they didn't have a primary care provider, you can call the unit directly and talk to one of our intake specialists and tell them what's going on, and they would take your information down and then call our physician to see if you were a candidate for admission. And then the other option, of course, we want to keep people out of the emergency room unnecessarily. So we want to help people get in without having to take that route. But if you did feel that there was a need and you needed to be seen immediately and you weren't safe, then you can go through the emergency room and we can evaluate you there.
So the behavioral health that you deal with at the hospital, it is inpatient. It's a little bit more advanced and intimate for people who need more intense care, right?
Yes, correct.
And are you finding that more and more people are needing to come and be evaluated and seen and taken care of by you?
We see a fair amount of people who do. And a lot of people reach out just saying, you know what, I'm not sure if I need to be in the hospital, but I know that I need something else. There's a lot of stuff going on in the world today, and it's really hard for people to process. So, yeah.
Do you feel like Mandy, we talk a lot about mental health on this show, and unfortunately the word mental health can sometimes have a negative stigma to it. Wish that were not the case, but many times it is. Do you feel like the term behavioral health is maybe a better way to talk about mental health? How do you feel about the terms?
I like to use the term mental health. I think that that's going to be part of breaking down the stigma.
Yes.
Is be able to talk about it and what it is, and it is your mental health.
It is mental health, yes. And so what are some of the ways that when a patient is inpatient with you, what's the day-to-day like? What do you go through with them? I'm sure it depends on case by case and what issues they're dealing with, but what do you do on the daily for your patients?
So on our adult unit, which is a unit for patients 18 and older, we don't treat any children. The patients have a very strict, we have a schedule posted, I'll say that. So you usually wake up in the morning, start with your morning routine, and it's very important to have a routine and to have some structure to your day. The patients would get up and eat breakfast, and everything is in a communal living space. So you have your hospital room, but you also have a common space where you can talk with other patients, play games, read, do anything leisurely that you can do. We have a television that people sit around and watch TV or watch a movie. And then our groups start. And the patients get at least 5 to 6 groups a day. And those are run by our team of social workers and counselors. And then the patients may get an individual group depending on what their need is. Then the nurses will, of course, administer the medication. They'll meet with their treatment team at some point in that time. They'll also meet with our physician, and they'll talk with them and see what their needs are and how they're responding to the therapy or setting up their therapy plan. And then they'll finish out their day with a nurse group, which will be a reflection group to talk about the things that went on during the day and how things went and what they need to work for. Also in there's a discharge planning group and a medication group, or a nursing group, we call it, that is led by the nurses to help the patients talk about, we often address coping skills, medication management, anything along those lines.
Are your patients allowed to have guests? Can guests come see them? Are they able to check themselves out at any point?
So there's lots of different answers to that question. If you are voluntarily admitted to a unit and you feel like you want to leave and the psychiatrist does not feel that you're a harm to yourself or to anyone else, then yes, you can leave at any time. However, if you were admitted on a 72-hour hold, meaning that you didn't want to come and the doctors felt like you needed to be admitted to the hospital, then you are there until the 72 hours are up, unless the doctor deems that you're able to go. We don't take any involuntary admissions, meaning that you're court-ordered for care. So, we do have patients from time to time who may say, "Oh, I'm okay. I want to be admitted," and then they come and we find that they're homicidal or they're suicidal, and they have an active plan, and then they say, "Oh, I want to leave." Well, then you would not be allowed to leave, and that would fall into some Kentucky law regulation.
Mandy, I think it's so important that the hospital has a behavioral health, mental health capabilities for what you all do. How long have you been in the field of working with mental health and behavioral health?
I started working at the hospital on the behavioral health unit in 1990. And I've branched out and done several things in my nursing career and still do. And I do still have another role within the hospital. But since 1990, I've been working in mental health.
What would you say to people who are going through mental health struggles right now and they're considering getting help, talking to someone, going to see someone, maybe having a little trouble making that decision? What would you say to someone who's just going through some mental health issues right now about help being there and they're not alone?
I would say don't be afraid to talk about it. Always put it in, I always tell people, put it into the perspective of you have high blood pressure or you have a blood sugar level that's out of control. It is an illness. It is it's no different. It's just your mental health. And make sure that you reach out and talk to somebody. You know, the CDC says 1 in 5 adults experiences a mental health condition, at least one mental health condition a year. Mm-hmm. So everyone, I always say this, everyone may not have a wound, but everyone's going to have psychosocial issues that need to be addressed. That's just, we just need to recognize that. And that you can't be in balance without your mental health in balance. So reach out to somebody, find a friend, call the hospital if you have questions, but don't suffer through that alone. Make sure you reach out and get help.
Yes, and what is the best way can people get in touch with you? Can they call the hospital, call the office to maybe ask some questions about what you do and how to be a part of the mental health program? What's the best way to get in contact with you?
Yes, they can call the hospital at 606-678-3440 and ask to speak with an intake nurse.
And they can do that themselves, right? They don't have to. The doctor, right. Their current doctor doesn't have to do that for them. They can do that.
Right. You know, I do encourage people, if they have a primary care physician they're working with or a counselor, reach out to them. But if they want to speak to somebody directly to see if they qualify for being admitted to the hospital, they can call the unit directly, and our intake nurses will help them.
Mandy, thank you so much for calling in this morning and for the work that you and your team do there at the hospital with behavioral health and mental health. It's so important. So thank you for what you do and for telling us all about this. A lot of good information this morning.
And there is also a direct link if someone wants to go to the springs at lakecumberland.com. Then you can watch a nice video, and it shows the unit and talks about the unit.
Okay, and that is the springs at lakecumberlandhospital.com?
Just at lakecumberland.com.
At lakecumberland.com. And we'll put that link and also the telephone number where people can get in touch with you on the Mid Mornings with Amy Facebook page if people need to go back and get the information.
Okay, great.
Mandy, thank you so much for calling in, and you have a wonderful rest of your day.
You too. Thank you.
That was RN Mandy Lynch, the Director of Behavioral Health at Lake Cumberland Regional Hospital. And if you want to talk with Mandy and her team to just ask some questions and get some help, you can call 678-3440 or visit the springs at lakecumberland.com. That was Medical Minutes presented by Lake Cumberland Regional Hospital. It is 8:43.